get on here to talk about vestibular rehabilitation therapy. That is what I always am talking about in my personal life. It is my full-time job. I love VRT. I love seeing the things that it can do for people with vestibular disorders, and I'm so excited to share that with you guys today. I did ask last week on a question slide what questions you had about VRT, and I have them all written down next to me. I'm going to try answering those first, and we'll see where we go from there. If you guys have questions, I'll do my best to answer all the ones I have written first, and then if you guys have questions in the comments, you can go ahead and ask those too. I'll try to scroll up at the end and see if there are any I can answer. I also wanted to note that none of this is medical advice. Always talk to your doctor first to see what is best for you with your physician, your healthcare team, your PT. Always listen to your healthcare providers before you listen to someone on the internet. Although I am a doctor of physical therapy, I am not probably your doctor of physical therapy, okay? So that being said, let's start with what is VRT. So VRT, or vestibular rehabilitation therapy, is the kind of therapy or physical therapy that strengthens and treats your vestibular system. So your vestibular system is this really small, you have two, inner ear complex. And basically what it does, it tracks acceleration, change of speed, right? Acceleration and deceleration. It tracks spatial awareness. It tells you where your head is in space. Am I left? Am I right? Am I up and am I down? Am I moving forward? Am I moving at an angle? Back and forth. It tracks all those things. If you have a vestibular dysfunction, such as vestibular migraine, vestibular neuritis, BPPV, vestibular or Meniere's disease, acoustic neuroma, pre or post-op, any of those things, vestibular rehab can help you. It treats the symptoms of imbalance, spatial awareness, loss of control feeling of lightheaded, and dizziness. You do this by pushing into your dizziness symptoms a little bit. So how it works is I like to say it's just like strengthening a muscle. When you have a muscle that needs to be strengthened, let's say your bicep, okay, and I have a pen in my hand. I can curl up and down just this pen. Let's say I'm pretty weak right now. I can't do more than this pen. If I want to be able to lift, let's say, my water bottle, I need to do smaller weights or weights in between this pen and this water bottle over and over and over again. I'm probably going to get a little bit sore, right? I go to the gym, I get a little sore, it's all good. You're going to do that, but get yourself a little bit dizzy over and over again in order to strengthen your vestibular system. So it's just like strengthening a muscle, but it's strengthening the connection in your vestibular system to your brain, which is called your vestibulocochlear nerve, so that when you move, your brain doesn't go, oh my God, I'm dizzy and I don't know what to do. That's what VRT is. So someone asked a very good question. Can your brain compensate? And compensation is what we say when we're trying to talk about habituation, basically is what this person's asking, which is doing something over and over and over again until you realize, oh, this is a normal movement for me. So can your brain compensate without VRT if you have a vestibular disorder? The answer is it depends. So yes, technically, your brain, if you did a lot of movements by yourself and you went by that concept we just talked about with strengthening your muscle to strengthen your vestibular system and did the things that made you uncomfortable over and over and over again in a graded and scaled way, your brain probably could compensate without VRT, and that's great. The issue with that is that most people that I see and most people that I think exist in the vestibular rehab world of people that all the practitioners see is that when people get dizzy, they tend to stiffen up and not move. So if you are a person who you know that without help, you're not going to make yourself and force yourself to do these uncomfortable, scary movements because it's anxiety provoking. You don't know if you're doing too much or too little. There's so many small concepts within this practice that you might do it wrong. You might be afraid of doing it. So usually people don't compensate without VRT because they tend to stiffen up and not move at all. But if you moved, you did all the things, you did VRT without a PT, then potentially it could get better without you doing anything with a professional. Next question is, how much normality and of function can you get back when doing vestibular rehab? So this is a question of, it's kind of loaded, and the answer is it depends on the person. So if you are looking to increase the amount of functional activities you can do with VRT, then great. We are going to help you get through all of that. You're going to be able to hopefully drive a car again, take your kid to school, watch soccer games and basketball games, go to the grocery store, do a Target run, all those things that you want to be able to do functionally. All those things can be helped with VRT. The problem is that VRT doesn't treat the actual underlying condition necessarily. So it treats the functional deficits of your vestibular system. It doesn't treat the underlying condition like vestibular migraine. It can increase your migraine threshold, so stimuli aren't as stimulating anymore and not as bothersome, but it doesn't treat the actual neuronal condition. So if you are a person trying to treat vestibular migraine with this, you will be able to treat the symptoms and the functional deficits, but you won't necessarily be able to treat the actual migraine itself. That's not how this works. So you need either a neurotologist, neurologist, or ENT to help you with that. And if you start a program that changes your lifestyle, like you're moving more, you're more active, you have some dietary triggers that you might be aware of, you're sleeping 8-ish hours a night, consistently all the time, all of those things are all going to increase your migraine threshold to decrease the likelihood of you getting a migraine. And so the normality that this person asked about getting back can really fluctuate and can really depend on what exactly you're looking for. So being really clear with your PT when you start VRT, hey, this is what I'm looking for. I would like to run a 5K again and drive my kids to school. And we're going to think about those things when making your plan and making your goals, because my goals and my plan for each patient are not the same. They vary very widely. If someone doesn't care about driving to and from school every day, we're not going to focus on those things, right? So it really depends on how much normality you're going to get back, what that looks like for you, and what your personal goals are. So how long does it take for VRT to start to work? This depends on how new the diagnosis is, other things that you're doing to help with treating the underlying condition. It also can help to know, like, how consistent are you with your exercises and things like that. So the more consistent you are with your exercises, you have to do your exercises at least 15 to 20 minutes a day. That's how long it takes for habituation and adaptation to happen in your vestibular system. So that's step 1. Step 2 is you then need to be consistent about doing those exercises. And then you have to also figure out what your lifestyle modifications might need to be. If you have a vestibular neuritis, it's probably going to happen more quickly because not as many lifestyle modifications need to be made, because that's an infection in your inner ear that should go away over time, and the recovery time is decreased with BRT. Something like vestibular migraine or Meniere's disease, where you need to be aware of what your environmental triggers are, what things are bothering you during the day. Are you really sensitive to caffeine? Are you doing better with a medication, not doing so well with a medication? Talking to your healthcare team, all of the people involved in this will really help. However, in standard VRT world, we say that typically you can start to see a difference in between 4 and 6 weeks. So it's not like you're going to be 100% better in 6 weeks, but you should start to be able to see a difference in the strength of your vestibular system and be able to drive 5 minutes, 10 minutes, 15 minutes, if that's our goal, being able to drive to school, let's say, instead of getting in the car and immediately feeling sick. So focusing on the smaller goals within the larger goal will help you determine if you're actually getting better. And it's really, really important that you tell your vestibular therapist whether or not the exercises are helpful and working. The exercises should make you feel a little bit dizzy while you're doing them, and then you should be able to reduce the dizziness after within 5-ish minutes, 3 to 5 minutes, depending on your therapist, at home every single day. The next question is, does it help vestibular migraine? We kind of touched on that. It can absolutely help vestibular migraine by increasing your threshold to the kind of migraine zone of your brain, but it doesn't treat the actual underlying condition that is migraine itself. Is it ever too late to start vestibular rehab therapy? That's a great question, and the answer is no. Just because your vestibular migraine or your Meniere's disease or whatever your vestibular dysfunction has been going on for 10, 15, 20 years does not mean that you can't do something about it now. So you can always start vestibular rehab, but it might just take a little bit longer for your brain to exhibit the positive neuroplasticity that it's going to take in order to feel less dizzy. So last week with Dr. Kostalnik at Rooted Behavioral Education, she and I talked about positive and negative neuroplasticity. And so if you are getting dizzy all the time and it's leading to anxiety, which is leading to dizziness, and that cycle has been going on for 10 years, it might be harder to break than for someone who just got a diagnosis, let's say 6 weeks ago, 6 months ago, and is starting vestibular therapy immediately. So being able to remake and rewire those neurons to say, hey, this thing might make me dizzy, but it doesn't have to. You sit, you would do grounding, you stand still, you do deep breathing. After you get dizzy each time, that positive neuroplasticity will begin to really make a difference and help. So if you are in a certain state or country, will VRT work for you? No matter where you're located in the world, doesn't matter, VRT will still work. It's about finding a specialist. So I have seen some connections I have in Canada, in Australia, and then all over the US. Outside of that, I am not sure of or aware of particular vestibular therapists. I think I know some in Germany too. So if you're in any of those places, please feel free to contact me and I can set you up with those people that I know. So again, that's the UK, Australia, Canada, maybe Germany, and all across the States. It won't make a difference where you are in the world. VRT is always helpful, but I just know, so person who just said UK with a therapist, let me know. DM me either now or after this or whatever, and I'll help you get you set up with that. So grounding is the act of sitting still or being still and feeling your body on a firm surface. So you can do this standing against a wall, you can do it sitting against a wall with your feet out straight, you can do it sitting in a firm chair. So right now I'm in a chair. It's not a firm chair, so it's a bad idea to do it on here, but just for the purposes of this, my back is in the chair, I'm sitting, my feet are flat on the floor, all of my body is on a firm surface, and you sit here and you just say, I am still, I am calm, I'm in a relaxed position, there's no reason I need to be dizzy, let's breathe in and breathe out. And you do that and repeat it until you feel like you are back down to your dizziness baseline. So I have patients do this between every single exercise. So we might do VOR times 1, which is what it looks like this. We go, okay, gaze stability, 15 seconds, that's up. Okay, now I feel really dizzy. I'm gonna either sit or stand, depending on where we are in rehab. And you are going to sit there and be like, okay, I'm okay, this is fine, I'm not dizzy, let's get back to baseline. Your baseline doesn't have to be 0. If you're a 1 or a 2 for the day out of 10 dizziness, great. Then we're gonna get you back down to that 1 or 2 out of 10 dizziness. Okay, someone just asked, is VRT helpful while having BPPV? Some VTs don't recommend it. So I recommend always treating the BPPV first. So BPPV can be treated with a roll maneuver or an Epley maneuver, any canalith repositioning maneuver, because it's a mechanical problem. When the otoconia in your ear, they slip into the canals in your inner ear and they kind of rock back and forth in there. They make your eyes twist and move when you change positions in a big way. So if you go down to lay down and the room spins, or you sit up and the room spins, anything like that, you might have BPPV. I always recommend treating that first. That's important because it can increase your risk for dizziness and falls and vestibular dysfunction. But if you are having recurrent BPPV, there is usually a reason. So if you have BPPV once in your life and you're good to go, never happens again, great, good for you. It might have been just a weird thing that happens. It affects almost 2 of the world every year. So I wouldn't be surprised if someone you know or if you have one-off BPPV. That being said, if you know you have vestibular migraine or Meniere's disease or some other dysfunction in your inner ear, you're going to be more prone to getting BPPV. If you're getting BPPV and it's not going away from roll maneuvers, you might have a different kind, or canal with repositioning maneuvers, you might have a different kind of vestibular dysfunction, or you might have a different kind of positional vertigo. So positional vertigo, sometimes I've seen it with MS, I've seen it with vestibular migraine, I've seen it with something called like cupula. So if you have BPPV that just won't go away, please look into other things that could be causing it, because VRT could help like treat those symptoms overall. So if I'm treating a patient for vestibular migraine, we're doing regular classic VRT, or we're doing gaze stabilization, motion sensitivity training, etc., then I will be like, oh, you have BPPV symptoms? Okay, let's treat that, and we're going to go back to our regular VRT, because BPPV should go away within 1 to maybe 5 treatments. Like, it should be pretty easy when you have to treat if you have a specialist helping you. Next question, can VRT help with veering one side or the other while walking? Absolutely. So I do a lot of walking with head turns with people, walking in a straight line, using first like a piece of blue tape to walk along, or like the floorboards in your home, something like that. And then we move on to walking in the street with head turns, walking without head turns, looking up and down, window shopping, and making sure you're still in that straight line. If you continue to walk and it's in this zigzag way, you are a little bit training your brain that like, hey, walking like this is just fine. I myself have never been a very good straight line walker, but as I've been a vestibular therapist, I've actually noticed myself being able to walk in a straighter line without thinking about it. So VRT really does help that. Someone asked about the logistics of VRT, which is, can I go at first and then take a few weeks or months off and do the exercises myself? You absolutely can do this. So I think it's important that everyone has individual access to VRT. And so that for some people means, hey, this is too expensive for me, or too far away for me, or whatever the barrier might be to you. So I think it's important that you know, if you are really, really compliant, you don't have to go to VRT very often. So VRT can help the first couple weeks, let's say. I usually have people who are like, hey, I can't either meet with you very often because of time, because of finances, like whatever it is. I'm like, okay, the first 3, maybe 4 weeks, we're going to meet together every week. And then as you understand how to progress exercises on your own, how to make sure this doesn't make you feel worse, how to make sure it's still helping you functionally, then we can do every other week, every 2 weeks, every 3 weeks, etc., whatever have you. And so you absolutely can just go for the eval and be like, hey, I don't want to come back for 3 weeks. How do I make that happen? And so usually I recommend the first couple weeks you stick with your once a week therapy and then you taper it off. But if it really is an issue for you, there are always options for it to work. In that vein, if traveling to the therapist's office is problematic, I 100% recommend you ask if they have a telehealth option, because in my experience, vestibular therapy via telehealth, with the exception of sometimes BPPV, can be just as effective as in clinic therapy. Someone asked, can BPPV go away on its own? Theoretically, it can, but if you look at the anatomy of the inner ear, it's not very likely to go away on its own. Your inner ear has these 3, they kind of look like this without my pinky, these 3 canals. So you have your anterior one, your horizontal one, and your posterior one back here. And these crystals kind of rock back and forth in there when they're not supposed to be. And they're supposed to be in your otolith organs, so the job is to roll them back in there. I have seen it happen where people, it just goes away there on their own, like patients who I've seen before. They're like, hey, I have BPPV again. They email me, hey, I'm out of town though. Can I get an appointment next week? And by the time they come back, sometimes it's gone. It's like 1% of the time. I have not seen it very often. If you're having positional vertigo that seems to go away on its own and it happens all the time, there's probably an underlying like migrainous or Meniere's condition. What's the difference between VM and 3PD? So they have they often come together, but vestibular migraine is a migrainous problem, a neurological condition in your brain that causes vertigo, dizziness, imbalance, lightheadedness, feeling like you're walking on eggshells or water or whatever. Lots of different symptoms for that. That is caused by a cortical spreading depression in your brain, which is a series of really high activity, really low activity, and it creates this spreading depression, basically is what's called, and it usually affects classically your trigeminal nerve, which is a cranial nerve. It's number 5, and it goes out from your brain and it goes like this into your face, and you have 1, 2, 3, and that's what creates the classic head pain. However, you have your trigeminal cervical complex. I always get confused on that word, but it's trigeminal and cervical. They have a complex, and it's really closely related to your vestibular nerve. So in some people, that triggers a problem in your vestibular nerve, and that's what causes vestibular migraine. 3PD, on the other hand, is a chronic dizziness condition where most days for the last 3 months you've had dizziness, lightheadedness. It's not vertigo. That is on most days. It waxes and wanes with the problems. There are a bunch of criteria you have to meet. There is an underlying condition for 3PD. It doesn't just usually spontaneously happen. So if you are experiencing the symptoms of 3PD and you're like, hey, I'm trying to treat this thing, the best things to do are to go to cognitive behavioral therapy or acceptance and commitment therapy, whatever kind of therapy works for you. And then to also go to VRT to treat that. And oftentimes the anxiety with the dizziness is what causes the VRT to happen together, or the two conditions to happen together, pardon me. So that's the difference. What's the line of treatment for vestibular neuritis? So vestibular neuritis, if you catch it in the first 72 hours, if you have a good ER doctor or PCP, then that's great. And hopefully they will catch it in the first 72 hours, like, oh, this person is spontaneously dizzy. Sorry, I think my phone just went off. So they're feeling really ill for whatever reason for 72 hours. It's oftentimes vomiting, nausea, room spinning, dizziness. That is a infection in your inner ear nerve. That can be, that's typically what presents as vestibular neuritis. And if your really good doctor catches that, they can put you on a steroid in the first 72 hours, and that improves long-term outcomes. If you don't catch it in the first 72 hours, get super anxious about, start with VRT. Find yourself a neurologist that specializes in vestibular disorders, a vestibular physical therapist, an ENT that specializes in vestibular disorders, which is a neuro-otologist, and they will be able to help you. Vestibular.org/healthcare-directory will help you get you pointed in the right direction. And that is the best treatment for neuritis, because after the first thing happens, you can't, after the first neuritis happens, it pretty much is a 95% chance it will never happen again, but you might have some gaze instability because your nerve isn't functioning as well on one side or the other, and so you might have trouble with like turning your head back and forth, sharp turns, walking with head turns, etc. So VRT is what helps that. Okay, someone asked, one second. Can you differentiate against dizziness and vertigo? So vertigo is the incorrect perception that you or the room around you is spinning. So if you have, let's say, BPPV and you lie back into the dependent position of this canal and the room spins, that's vertigo. Technically rocking and swaying, but not, that's vertigo. So the incorrect perception of movement is vertigo. Dizziness is everything else. So it's a huge umbrella term. Technically vertigo is dizziness, but dizziness is not vertigo. So that's important. I'm going to say it again. Dizziness is an umbrella term for everything. Vertigo is a kind of dizziness, but dizziness does not mean you have vertigo. So you can feel lightheaded, muddy-headed, like things just aren't right. You might feel off, not like yourself, like you're have difficulty turning left and right, and up and down, etc. That's not necessarily vertigo. The incorrect perception of movement is vertigo. Okay. One of the last questions is that my doctor said that I can't do VRT until my meds start to kick in. So yes and no. Some people, you're just, let's say a person newly diagnosed with vestibular migraine, you haven't started anything yet. Your doctor might have put you on B2 and magnesium and CoQ10 and just said, have a nice day. See you in 6 months. Sometimes that can happen. Other times your doctor might just send you to VRT. Other times your doctor might put you on a migraine preventative. It really is so dependent. If your doctor said, I don't want you to start VRT until you are medicated for 3 months and let's see if that has a difference. Some people that's necessary, because some people, if I move your head like this, you're going to get in a full-blown like vestibular migraine vertigo attack. And that is so not where we want to start vestibular rehab. So if you're that kind of person where this gets you fully vertiginous, yeah, it's probably a good idea for you not to start VRT yet. However, VRT can be helpful in not getting rid of acute attacks, but for things you can do during an acute vertigo attack, like breathing, like grounding, like going to lie down in bed, feeling safe, decreasing the anxiety. All those things can really help. So it really depends on you. I do recommend usually just an evaluation from a vestibular therapist when you first get diagnosed in order to know if you're at that place where it might be a good idea for you to start VRT or not. Okay, what is the difference in symptoms / how to differentiate between VM and 3PD? So there are exact criteria. I don't have them memorized off the top of my head, but there are exact criteria for vestibular migraine and 3PD. And so I would encourage you to Google those and say, do I have VM or do I have 3PD? Do I have both? Remember, 3PD cannot happen on its own. So you have to have an underlying thing. It can be an anxiety attack that can cause 3PD. It can be VM that just won't go away. And on the underlying condition can be VM, it can be Meniere's, it can be neuritis. It really is dependent on you. It is treatable, but the symptoms can kind of be hard to differentiate because the interictal symptoms between VM might just be from VM, and that means that symptoms between the attacks. So I really encourage you to Google diagnostic criteria, vestibular migraine, diagnostic criteria, PPPD. Both those will pop up and you can kind of see what happens. Can beta-histine help with vestibular neuritis? It depends. I don't see it a lot with vestibular neuritis. Usually I see it with Meniere's disease, but it is up to you and your doctor. Let's see. What are my thoughts on FL41 lenses or migraine specs? I love migraine shields. I think they're super helpful, especially for computer things and going into stuff like into huge box stores, things like that. If you find yourself wearing sunglasses inside, I really recommend you get a pair of FL41 glasses, either migraine shields, their specs, whichever ones make you happiest. Because wearing sunglasses everywhere, outside is fine. You can wear sunglasses outside. But if you find yourself wearing sunglasses inside, it's actually blocking like every single spectrum of light, and that can make you hypersensitive to light, which you probably might be already if you are. So it's making the hypersensitivity worse. So I would recommend getting a pair of migraine specific blue light blocking glasses. Have I ever seen anyone with MS diagnosed with vestibular neuritis and horizontal nystagmus? Yeah, that definitely can happen. They can happen independently of each other. If you have MS, it doesn't make you necessarily less likely to get vestibular neuritis. So that's definitely a thing that both can happen. All right, what are your thoughts on VM in pregnancy? Is there anything I can do to get relief? So I would ask your OBGYN how they feel about things like magnesium and natural supplements in order to help that. And then I would track your triggers, because sometimes there are things that you might crave during pregnancy that you might not have before that are increasing your symptoms. Remember, migraine's not your fault. It's not because you did something specific. It's just a hormonal problem with pregnancy that's causing the cortical spreading depression. But there are things that you can do to help manage it, like lifestyle, diet, exercise, things like that. So get your 30 minutes of exercise, try to eat really well, like whole foods, look at your diet, see what it is consistent of, and be like, oh, every time I eat this thing, I feel really vertiginous or feel really dizzy afterwards, and let's try to do something about that. And then I recommend VRT either during or right after pregnancy in order to help retrain your vestibular system. What is the diet for vestibular neuritis? There isn't necessarily a diet for vestibular neuritis, just eating whole, healthy foods, just like you always should. Fruits, vegetables, whole grains, protein, fats, all good things for that, because you need to heal a nerve. And we can't regrow nerves in vestibular neuritis. We can just retrain our brain, so that will help with that. Persistent downbeating is diagnosed with right torsional. I can't answer this specific question on Instagram Live. You can DM me and we can see what we can do about that. But if you've truly had BPPV 80 times in the last year from a concussion, and you have access to a concussion specialist, I would ask them, because I think you've DM'd me before, and I wish I could help, but I cannot help you with that problem. Yeah, okay. I'm so happy to hear you're starting VRT next week. It's gonna be great. Alrighty. Okay, if anyone has any more questions, I'll give you guys a minute to ask. But if not, I will let you guys go, and I'll see you on live next week. If you have anything specific you'd like me to cover next week, please let me know, and I absolutely can talk about that. And then also, I will post this so you whatever time. All right, guys, looks like there's no more question. All right, I'll see you next week. Bye.